Everyone, so my name is Kassidy Lane. Today I'll be speaking with you on HIV/AIDS, specifically how one becomes infected, how it spreads throughout the body, and the long-term effects. So some lesson objectives: inform how one becomes infected, describe what happens to the immune system, and test the knowledge at the end of the presentation. The purpose of this lesson is to educate on how HIV/AIDS can spread not only through sexual contact, talk about the different stages of HIV turning to AIDS, and how it attacks the immune system and long-term effects. So, HIV stands for Human Immunodeficiency Virus. It's the virus that can lead to acquired immunodeficiency syndrome, or AIDS, if not treated. The human body cannot get rid of HIV completely, even with treatment. So what the treatment does is it controls the virus in your body, but it never fully goes away. So there are 3 stages that HIV can go from HIV to AIDS. And so there's stage 1, which is acute HIV infection, which is 2 to 4 weeks after infection with HIV. People may have flu-like illness or symptoms that may last a few weeks. Stage 2 is clinical latency, or HIV inactivity dormancy. It's the period that sometimes is called asymptomatic HIV infection or chronic HIV infection. So it is still active, but it reproduces at very low levels. And for people who aren't taking medicine to treat it at this time, this period can last about a decade or longer. And finally, stage 3, which is acquired immunodeficiency syndrome, or AIDS, the most severe phase of HIV infection. Immune system is badly damaged with an increasing number of severe illnesses called opportunistic illnesses. And without treatment, people with AIDS typically survive about 3 years. So how does one become infected? You can only get HIV by coming into direct contact with certain body fluids from a person with HIV, such as blood, semen, rectal fluids, vaginal fluids, or breast milk. So for transmission to happen, HIV in these fluids must get into the bloodstream of an HIV-negative person through a mucous membrane, open cuts and sores, or by direct injection. People with HIV who take HIV medicine daily have effectively no risk of sexually transmitting HIV to their partners. So basically, this is how it enters your body. So having vaginal or anal sex with someone who has HIV, so unprotected sex and also anal sex is riskier than vaginal sex. Sharing injection drug equipment. And another thing that people don't realize is it can happen with tattoos and piercings also. So make sure that when you do get a tattoo or piercing, that the person that's doing it is properly cleaning his equipment. From mother to child during pregnancy, birth, or breastfeeding, but the use of HIV medicines have helped lower the risk of mother to child transmission of HIV to 1%. Struck with an HIV contaminated needle. This usually happens with healthcare workers, but again, that has also become very low. And also receiving blood transfusions, but it is extremely small these days, but I wanted to add that in there because it was really interesting hearing my mom talk about it, because when she was receiving blood transfusions in the 80s, that was something to be concerned about. So HIV attacks a specific type of immune system cells in the body known as the CD4 helper cell, or T cell. When destroyed, it becomes harder for the body to fight off infections, so when left untreated, even a minor infection such as a cold can be severe. Not only does HIV attack CD4 cells, it also uses cells to make more of the virus. When the virus has destroyed a certain amount of CD4 cells and the count drops to 200, a person will have progressed to AIDS. So there are HIV treatments, and they're called antiretroviral therapy, or ART. It is recommended for everyone who has HIV and to get it as soon as possible. The medicines do not cure HIV infection, but they do make it manageable chronic condition, and it also reduces the risk of spreading it to others. Now, there are several types of HIV/AIDS medicines, but I wanted to talk about the ones that work by blocking or changing enzymes that HIV needs to make copies of itself. And this prevents HIV from copying itself, which reduces the amount of HIV in the body. So there is nucleoside reverse transcriptase inhibitors, which block the reverse transcriptase enzyme. There's non-nucleoside reverse transcriptase inhibitors, bind to and later change the reverse transcriptase enzymes. Those are tongue twisters. Integrase inhibitors, which block the integrase enzyme, and protease inhibitors, which block the protease enzyme. So I wanted to do a little assessment at the end of this presentation. So the first one is true or false, HIV can be transmitted by breast milk. And that answer is true. The second one is how does one become infected? A, vaginal or anal sex, B, drug equipment, C, used medical needles, or D, all of the above. The answer is D. And then finally, what is the second stage of an HIV infection if not treated? A, clinical latency, B, acquired immunodeficiency syndrome, C, acute HIV infection, or D, lymphoma. The answer is A. There are my references. Thank you.